Welcome to today's press briefing. With us today are Dr. Albert Au, Principal Medical and Health Officer, CHP, and Dr. Lau Ka-hin, Chief Manager, HA. Dr. Au, please. Fellow citizens, friends of the media, I'd like to report to you the COVID-19 situation as of 20th of May. There are 103 PCR positive cases, 23 from the HA, 16 from the public health lab, and the remaining 64 from the private lab. 125 RAT positive cases were registered yesterday. We have registered 228 positive cases yesterday. Cumulatively, in the fifth wave, we have registered 1 million odd cases, 748,497 PCR cases, and we have 16 imported cases and 200 locally acquired cases. And the imported cases were picked up from the airport and hotels. There are 5 that were picked up from the airport temperature specimen collection centers, 17 from the quarantine hotels. There is 1 that was picked up on day 3, 1 day 7, and 4 from the US, 3 from Singapore, 2 from Thailand, 1 from UAE, and 1 from Indonesia, 1 from France, and 1 from Spain and Russia. From the public health lab, 108 cases were analyzed. 104 tested to be negative for L452R, and the other ones didn't have enough viral load. For the whole genome sequencing, there are some new cases. There are 10 that BA.1, BA.2.12.1, and there are 5 female and 5 male arriving in Hong Kong on the 22nd of April. And there are 5 from the airport testing positive. 1 tested positive at hotel on day 5. As of now, we have registered 56 BA.12.1 cases. 42 of them were picked up at the airport. 12 were picked up at quarantine hotels, and the remaining 2 were picked up on day 12 at the community testing center. That's the 2 from yesterday. They were imported from 37 from the US, 5 from the Netherlands, 3 from the UK, 3 Singapore, 3 Canada, and the remaining Australia, Israel, and Nepal, Turkey, and Qatar, 1 each. There are 2 BA.4 cases from yesterday involving 1 52-year-old male who had 3 BioNTech shots. They arrived on the 17th from Mexico. On May 17th, he developed symptoms. The other one, 22-year-old male, he had 2 shots of BioNTech. On May 17th, he arrived from the UK. The airport specimen tested positive, and on May 18th, he developed symptoms. As of now, we have registered 11 BA.4 cases, all imported. 6 were picked up at the airport, and the remaining 5 were identified on day 5 from the quarantine hotels. And they were 6 from the UK and 2 from South Africa, Canada, the US, Mexico, 1 each. Yesterday, we had 3 BA.2.12 cases, all imported, involving 2 males and 1 female, ranging in age from 21 to 69. All had 3 shots of BioNTech. On May 16 to May 17, they arrived in Hong Kong. 3 were tested positive at the airport, 2 from Canada, 1 from the US. As of now, we have 10 BA.2.12 cases. 8 tested positive at the airport, 2 on day 5 testing positive at quarantine hotels, and they are 3 from the US, 3 from Canada, and 2 from Australia, Germany, and India, 1 each. No cases from the RCHDs or RCHEs. Today is school holiday. We don't have any new cases. I'd like to supplement that yesterday afternoon, this wasn't reported yesterday. Yesterday afternoon, we have received 2 cases from schools involving some students, or 5 students from the same school, and they tested RAT positive last day at school, May 18th. They didn't go to school on May 19th and 20th. On May 19th, they were off sick, and they tested RAT negative. On May 20th p.m., they tested RAT positive for the first time. In the same class, there was a previous case dated May the 17th. Now, this earlier case, last day at school, was May 16th. And the person developed symptoms on May 16th. The person tested negative RAT and then positive in the afternoon. All these 3 students had 1 shot of vaccine. None of their family members were infected. There are 33 students in that class. 30 students tested negative RAT. Now, to play safe, we asked the school to thoroughly disinfect the school, and the students should continue with the RAT test. We will monitor the situation. Last week, 122 cases were reported from 112 schools involving 103 students and 19 staff members or teaching staff. 185,000 students conducted RAT test. The positive proportion is 0.013%. And 130,000 teaching staff members underwent RAT, and the positive ratio was 0.015%. And this is at a stable level. We didn't have any fatality case yesterday. Cumulatively, in the 5th wave, we have registered 9,157 death cases. The fatality rate was 0.765%. Now, updating you, some cluster, the Lan Kwai Fong Hotel, the CHP, together with the MSD, the BD, and the HKU, Dr. Yun, Professor Yun's team, 15 samples were collected. 1 tested positive in room 304 near the extraction fan in the toilet. There was 1 sample that they were indeterminate. In this 304 room, we collected the sample at the purifier. For all the remaining cases, they tested negative, including the air duct on the rooftop, and the 7 samples in 3204 in the toilet, in the extraction exhaust fan, and the air duct vent, door handle, and purifier. And 3303, the remaining 5 samples tested negative. The Hong Kong U team yesterday collected some air samples for testing, all testing negative. To play safe, we have arranged for all the staff members of the hotel and those occupants in the hotel to undergo today PCR tests. And after May 7th, all these rooms where the occupants who stay in these at-risk rooms will be followed up, and we looked at the day 10 specimen, and we found no positive cases. Now, for those two who tested positive on day 12, there are 11 places that have been subject to CTNs, 9 restaurants, 1 cinema, and also the Marine Office. As to benchmark and also Tamjai Samgo in Shangwan, now benchmark on May 11th to 15th, all the students and staff members, there are 4 additional cases, all involving students. One 53-year-old male on May 15th at nighttime. He attended a graduation ceremony. He developed symptoms on May 17th and tested positive on May 18th. There are 3 students who on May 18th to 19th, they developed symptoms, and they went to a Tamjai, and on May 19th, they tested positive. Now, for benchmark cluster altogether, there were 27 positive cases, 19 students, and 2 staff members. And for environmental samples, we have collected 20 environmental samples. And from the classroom, from the air duct, the sample tested positive. All the 19 samples tested negative. Tables, chairs, purifier, the partitioning, the lockers, water machine, and the piping and so on. Tamjai Samgo cluster, there are 3 additional cases. These 3 cases are one of the 4 that I mentioned. All of them are from benchmark school. There are 8 cases from Tamjai, including 7 students.
Over to Dr. Lau, who will tell us about the HA situation. There are 533 patients that staying at public hospitals, North End Hospital Infectious Disease Infection Control Center and the Hospital Authority Infectious Disease Center. 65 additional patients being among them. Among those who require isolation facilities, 90 are in isolation ward, 22 are in Tier 2 isolation ward, 47 at the North End Hospital Hong Kong Infection Control Center. In total, 29 are additional new patients. Yesterday, no new reports of severe cases were made. Among those staying in hospitals, altogether 10 are in critical condition and 10 in serious condition. 3 critical patients are in intensive care. Yesterday, no patient passed away. 84 patients were recovered, 68 were discharged. In the 5th wave of outbreak, 49,781 patients have recovered, 49,462 have been discharged. Since the early this year, our city has had 62,161 patients who have recovered, 61,842 have been discharged. No patient has been found positive upon hospital screening today. Among HA staff, 23,017 patient HA staff members have been affected. 23,886 have returned to work. That's all from me for today. The floor is now open to questions. Before putting your questions, please tell us your media outlet. The lady over there. I'm from Now TV. A question about the cases at schools. Which school is that? The students are from the same class. Have they engaged in any high-risk activities? Do you suspect any outbreak in the classroom? The first person got infected on May 17th. Do you believe this student is the source of infection? Now, turning to benchmark, the air duct sample tested positive. Do you believe there was airborne transmission? Was the ventilation in the classroom up to standards? At the Lan Kwai Fong Hotel at Khao Yu Fong, you mentioned the room 3304, the environmental sample tested positive. Based on the room 3304 where the couple lived, and then you're now tracing the incubation period, do you believe they were infected by the Nepalese father and son when they were almost complete with the quarantine period, Professor Yun Kwok-yung believed a large-scale outbreak is unlikely. What's the CHP's assessment? Starting from June 13th, specialist outpatient clinics will require a vaccine pass or a negative PCR result. But now RT use is widespread. So is it practice going to be like what we have with the dialysis places where RAT results are accepted? Now there are long queues at the specialist outpatient clinics. When this measure is implemented and the seniors forget to take a PCR test, will there be compassionate arrangement? And how will the appointment be arranged for these people? Thank you for your questions. First question, the school. This is a secondary school in the Southern District. We will not disclose the name of the school. We have got in touch with the school for a follow-up. The 3 students are in the same class. They are secondary 1 students in the same class. They had a mask on when they were at school, but some students told us that when they drank water, they briefly took off their masks. These 3 students are in the same class. They did not have meals together. They did not take off their masks and ate together. They were just in the same class, having classes. They did not engage in high-risk activities like playing wind instruments or taking part in phys ed classes involving mask-off activities. The first class was reported on May 16th. That was the day of onset. The student tested RT negative on that day, but after returning home in the afternoon, the student tested positive. That may be the beginning of the onset. The student stopped going to school since then. The other 2 students on 16th, 17th, and 18th, they went to school. On 19th, they developed symptoms, but they tested RAT negative. By afternoon on May 20th, they tested positive. All 3 had symptoms. At this point, we cannot rule out any link between them. That is, maybe they had some sort of activities in the classroom and they got infected. After all, the symptom onset dates are close to one another. Their family members are not COVID patients without any link to other cases in the community. So we're concerned. We have got in touch with the school to take some extra measures, including cleansing, disinfection, and for all students in the same class. Over these couple of days, they will have to do daily rapid antigen tests. We haven't covered new cases for this school. In other forms, including over 900 students and over 100 teaching staff members, they have tested negative all along. On Monday, we will keep following the situation to see if new cases are uncovered. Now, the second question concerns benchmark. In this cluster, from 11th through 15th of May, there are 30-odd students. 19 have tested positive. Our preliminary assessment is that certain infectious students went to class during the communicable period. They had masks on during classes, but there are times when they were at break rooms or in the classroom, they had to do presentations, they lowered their masks, and that may lead to transmission risks. We believe the transmission or outbreak happened towards the latter part of the program. Before the students went to school every day, they had to do a rapid antigen test. The results came back negative all along, except one student. On May 13th, one student tested positive, but the student stopped going to classes since then. We believe This was a human-to-human transmission, but we cannot rule out short-distance airborne transmission. There are a number of cases in this class. At the exhaust vent of the air conditioner, there were positive samples were found, but that's hardly surprising. The last question concerns Cao Yufeng. Yesterday, Professor Yun Kwok-yung explained this matter. In room 3304, we found a positive sample. That's at the exhaust fan in the toilet, but that's expected because 2 cases stayed at this room. On May 10th, one tested positive and left the hotel room. On May 11, another person tested PCR positive and left the hotel on May 12th. During the stay in the hotel, they did not have a mask on and released the virus, and that explains the contamination of the exhaust fan. And it's hard to disinfect the area with the inside. But as for the route of transmission, Professor Yun Kwok-yung explained this clearly. 2 cases were found in each room, but only 1 in each room had symptoms. In room 3303, a symptomatic patient had onset on May 10th, and then in room 3204, the symptomatic person had an onset on May 12th. It's hard to tell for sure whether the transmission happened from 3304 to the other room or the other way around. But we know that the transmission route took place through the sewage pipe. The positive pressure there directed the air into the room. For vaccine pass, this is nothing new. The vaccine pass has been around for a while. People use that when they go to restaurants or other premises. As the government announced today, starting from June 13th, this applies to places with appointments for non-emergency, non-urgent medical services. Vaccine pass will kick in for these places. That includes hospital authorities, specialist outpatient clinics. People who visit these specialist outpatient clinics are usually the seniors or those suffering from chronic illnesses or those in a serious condition. Seniors, those with chronic or serious illnesses. The vaccine will protect them and will be very effective in protecting them from serious COVID. From serious cases or deaths, most of such people were unvaccinated. Vaccination is highly effective in protecting against deaths and serious illnesses. We're reminding people again to get vaccinated because this is so important. There's still some time from June 13th. If you're unvaccinated, please go get your first shot as soon as possible. And if you have completed your first shot, go get your next shot. It's very easy to book a slot for vaccination now. In the beginning of the 5th wave of outbreak, people flocked to get vaccinated. It was hard to secure a slot. But now things have eased off. It's a good time to get your shot as soon as possible so that we can construct this immune barrier. At specialist outpatient clinics, this vaccine pass will kick in. But for some other premises, those providing emergency services like A&E departments or those premises catering to other illnesses like GOPCs or Chinese medicine clinics or those for renal dialysis or daycare centers, day services centers for the elderly, the vaccine pass has yet to be implemented. But we hope that people, especially seniors, those suffering from chronic illnesses or those immunocompromised, we hope that they can get vaccinated as soon as possible to protect themselves and the people around them.
Speaker not coming through. I don't think there can be any generalization because each hospital would vary in their operational flows. We do have flexibility. We accord priority to saving lives. All emergencies would be a given priority. We have to understand when the vaccine pass would be required. It's only with the vaccine pass that one can get access to certain premises. You cannot gate-crash into a premises in absence of any vaccine pass. It's simply not on. So the vaccine pass is intended for, in particular, for the GOPC patients, for people to understand how important the vaccination is, so they should get vaccinated before June the 13th. Next, please. Cable news. A question about the schools. For the class in question, would there be any class suspension? Also, a question for the HA regarding the vaccine pass. We have about 10 days or so away before 3 jabs would be required. Will patients be denied any treatment if they don't get the right number of jabs, and would they be denied the opportunity to seek medical attention? And for the chronically ill and also those accompanying the chronically ill, they also have to be vaccinated. Now, for the escorts, would you exempt these escorts in terms of the number of vaccinations? Thank you very much for your question. Regarding schools, we will monitor the situation closely. There are 33 students in this class, and 3 cases have been picked up. For the remaining 30 students, last week, from Monday to Friday, they underwent RAT tests. All testing negative, no symptoms were identified. We will monitor the situation to see whether there will be any cases emerging. And on Saturday and Sunday, we require them to undergo RAT tests. So far, we have picked up no cases. Monday morning, we will follow up on this particular school. The initial investigation didn't identify any high-risk factors like mask-off activities or having meals in the classroom and so on. So the risks are manageable for the time being. However, we will monitor the situation, as I said. When they are back on Monday, if there are emergence of new cases, there is a likelihood of on-site investigation to see whether there is a need for class suspension. As I said, the vaccine pass didn't start today. It has been around for some time. People know how to use it. When you gain access to a certain place, you need to present the vaccine pass. Now, if they fail to meet the vaccine pass requirement at the moment, there can be a PCR test. If they test negative within 48 hours, they can use this in place of the vaccine pass. I'm talking about the patients attending medical appointments. For the accompanying persons, and they have to observe the vaccine pass. Now, if they have been caring the chronically ill patients or senior citizens, their vaccination would be important. If they get infected, they may recover pretty quickly, but if they pass on the virus, things can be pretty dangerous. So everyone in Hong Kong, we need to count on every one of you to build up the immunity barrier. If, for some medical reason, you cannot take any jab, we all understand because there is some exemption granted. But otherwise, it is safe to get the jab. And I don't think we should be hesitating about vaccination. We should get vaccine coverage to build up the immunity barrier to minimize the risk of the senior citizens and the chronically ill. Now, if these people are vaccinated, they would guard against the possibility of severe cases or death. Commercial radio. A moment ago, you mentioned the school in Southern District. Can you divulge more information? Is it a co-ed school, boys' school, girls' school? For the 3 positive students, what gender are they? Can you make available more information, please? Well, this is a co-ed school in the Southern District. It is a secondary school, 910 students and 138 teaching staff members. In this particular class, for the 3 positive students, they're all male students. And they are students, they're acquainted with one another. They do have interaction in class. However, we haven't seen any interaction after school among them. And this is a mini cluster in this class. We will monitor the situation. Let's make it the last question.
I'm from Mingpao. A question about the secondary school in the Southern District. For the 3 students, were they seated close to one another in the class? Do the students in that class have to do PCR tests instead of RT? For the hotel at Khao Yufeng yesterday, it was announced that the wife had onset on day 12. But in terms of the places they've been to, they went to restaurants. What's the CHP's assessments of the relevant risks? After the wife developed symptoms, did she do a test or go to a doctor? Or was she unaware of it until she tested positive at a community testing center? Would there be advice for those with symptoms to get tested? And on Tam Kong Temple Road, these are mostly shipyards. If these couples stay there, will there be risks for the workers nearby? We have been to the places where the couple has been to. They were unaware that they have to submit the information from the vaccine pass. Have all these restaurants been notified of the situation? Why is it that some restaurants haven't been informed? Yesterday, Professor Yun said that some who stayed at the quarantine hotel may have to observe another quarantine. What's the CHP's assessment? How many people will have to undergo quarantine again? Thank you for your questions. The first question, the secondary school. All students in this class have been advised to do rapid antigen test over the weekend, even though there is no school. And if they develop symptoms, they should not go to school and should go to a doctor instead. On Monday, we will look at the RT test results to see if new cases are uncovered. RT tests are accurate in detecting cases, and they are convenient. People don't have to wait. They can just do it at home. And it's accurate. If people do RT tests every day, even though there may be a lower accuracy, but doing so on consecutive days will help uncover cases. If more students are infected, we may consider the possibility of issuing compulsory testing notice for them to get PCR tests, but it depends on how it plays out. As for the case who tested positive on day 12, one person developed symptoms on day 10. From what we have found out, this person has not gone to a doctor on day 14. This person went to a community testing center with family members. The CT value is low at 15. There is a risk for transmission in the community because symptom onset happened on day 12. The communicable period started from day 10, but from 10 to 15, this person engaged in activities in the community, such as going to restaurants. Even though the stay at the restaurants may be short, but this person took off her mask, so there is a likelihood that transmission happened in the community, especially for this BA.2.12.1 subvariant. Based on some preliminary information, this may be even more transmissible than BA.1 or the more generic Omicron variant. In terms of the risk, yesterday, Professor Yun Kwok-yong also explained this point. For those vaccinated or those who have been infected in the fifth wave of outbreak, they still have immunity to protect them against this BA.2.12.1 subvariant, but there is the possibility of immune escape. For these places this person has been to, these places have been subject to compulsory testing, so those who visited such places will have to get PCR tests. We will get in touch with the OGCIO to retrieve the information on the vaccine pass details for those who have been to those places at the relevant times, and we will inform the restaurants affected to conduct disinfection. The staff will have to get tested. The effort is ongoing. And for the address, it's an address on Tam Kong Temple Road. The person who tested positive with a CT value of 15, this person has been sent to quarantine Penny's Bay on the same day. The husband has been undergoing home quarantine with no contact with others. That concludes the press briefing. Thank you.